I'm Daniel Karlsberg, board-certified cardiologist and fellow of the American College of Cardiology. In aortic stenosis, one of the most common types of valvular heart disease, the aortic valve becomes narrowed and does not open all the way. This can create high pressures that the left ventricle, the main pumping chamber of the heart, must overcome. Over time, and depending on the severity of stenosis, this can lead to heart failure. The aortic valve is most often evaluated using an echocardiogram, which is an ultrasound of the heart. In this type of test, the valve itself can be directly visualized, and the pressure gradient across the valve can be estimated. Sometimes, a CT scan is used to help determine how the valve looks. Aortic stenosis is commonly divided into a few main causes. The most common cause of aortic stenosis is the gradual process of age-related degeneration and calcification. Calcium slowly deposits on the leaflets and the valve annulus. Eventually, they become stiff and can't open all the way. This process occurs really slowly over a long period of time, so we often see this in older patients. Aortic stenosis can also be due to congenital valve disease, such as a bicuspid aortic valve. This means that the valve was abnormal at birth. Sometimes the aortic valve can have only 2 functional leaflets instead of 3, and this is called a bicuspid aortic valve. While this malformation occurs at the time of embryonic development, it can lead to aortic stenosis later in life. Another common cause of aortic stenosis is rheumatic heart disease. We know that there is an association between rheumatic fever, which is a complication of strep throat, and aortic stenosis. While rheumatic fever typically creates stenosis of the mitral valve, untreated rheumatic fever and infection can ultimately cause aortic stenosis as well. There are some additional risk factors for aortic stenosis, like high blood pressure, high cholesterol, diabetes, chronic kidney disease, and prior radiation therapy to the chest. All of these causes, though, really lead to the same problem, which is that blood has to leave the heart through a valve which does not open completely. This means that the heart has to work harder, and over time it can create real problems and cause heart failure. Learn more at Learnyourself.org.